Welcome to the Learning Pines YouTube. We hope this video helps.
In this video, I will explain how to avoid hip replacement surgery. Many people experience hip pain, but surgery is not always the first or only option. We will explore several effective strategies to manage hip health and potentially prevent the need for an operation. By understanding these approaches, you can take proactive steps toward maintaining your mobility and comfort for years to come. Let's dive into the key methods. A cornerstone of avoiding hip surgery involves smart lifestyle choices. Reducing excess body weight by even 10 pounds can significantly decrease the stress on your hip joints. Regular, low-impact activities, such as swimming or walking, for 30 minutes most days of the week help maintain flexibility and strength. Consulting a physical therapist can provide a personalized exercise plan to strengthen crucial supporting muscles around your hip. When lifestyle changes aren't enough, medical treatments can provide significant relief. Non-steroidal anti-inflammatory drugs, or NSAID, are often prescribed to reduce both pain and inflammation in the hip joint. For more targeted relief, your doctor might suggest corticosteroid injections directly into the joint space. These injections can offer several weeks or even months of pain reduction, helping you continue with physical therapy and daily activities. Beyond standard treatments, advanced options and consistent preventative care are vital. Regenerative medicine, including platelet-rich plasma injections, aims to stimulate natural healing within the joint. Using assistive devices, like a cane, can offload up to 25% of the pressure on your hip, providing immediate relief. Regular consultations with your healthcare provider ensure ongoing monitoring and timely adjustments to your treatment plan, helping you maintain hip function.
Thanks for watching. Consider subscribing if we helped you.